I spend half an hour to an hour with each patient. I believe the diagnosis, patients have it. If you let them talk, if you get enough history, you will get the diagnosis. It's in the history. They're telling you, you just have to listen. And for you to listen, you have to have time to listen. When you give a patient 5 minutes and they have, especially if they're elder patients and they have multiple health conditions, you're not giving them enough time for them to even elaborate on anything. And you're not hearing, you're just in your mind thinking, I got to get to the next patient. Okay, here is a prescription. It became to a point that I think patients were expecting it. They were paying a $10 copay, going in for, say, a cough or a sneeze or a headache and wanting antibiotic. And a lot of doctors didn't want to argue, didn't have time to argue, wanted to get the next patient in. And that's when they were like, okay, here is a Z-Pak for you. Here is amoxicillin, and trying to get them. But that causes resistance with those antibiotics. If they're truly sick in the hospital with sepsis or pneumonia, then they really need those medication. Then guess what? The bacteria is going to say, I'm not going to work. A really fit gentleman in his late 60s that came to my practice. And of course, I asked a lot of questions and I examined him and I ordered his records from other physicians, which I love to always review that. And then I set him up for the testings we do. We do blood tests, a comprehensive blood test. It's like 13 pages, and I spent an hour going over it with them. As I was examining him, I heard a murmur, a heart sound that wasn't a normal heart sound. And I asked him to have an echocardiogram, which is an ultrasound of the heart. And he did the echocardiogram. The result came back showing consistent with all the changes you see with long-term hypertension. And so I called him back in. I said, we have your echo result. How long have you had high blood pressure? And this gentleman was so insulted. He's like, I've never had high blood pressure. In fact, I've had multiple surgeries in the last 10 years, and everybody tells me my blood pressure is like a 20-year-old. It's 110/60, which is like a 20-year-old. And I said, well, your echocardiogram and your heart structure doesn't tell me that. So I told him, let's put a 24-hour blood pressure monitor on you. We sent him home with one. He came back next day. I ran it through the computer, and I'm looking at his numbers. They're 110/60 all day. He falls asleep, it's 200/100, 210/110. I mean, it was so high that he would be a person that would have had a heart attack or stroke in his sleep and died. He said, why do you think that is? I said, I think you have sleep apnea. And he laughed. He's like, isn't that for obese people? I'm really fit. And I said, not necessarily, because that's a myth. I've seen very thin people that have sleep apnea. So we put him on another device and sent him home to check for sleep apnea, and he came back with severe sleep apnea. And when he tried the CPAP, it didn't work for him, but he finally got a dental device. And then we repeated 24-hour blood pressure reading. 3 months later, his blood pressure was 110/60 all night long as well. So this is somebody we saved his life without him having a stroke, being debilitated, ending up in a nursing home. Preventive medicine or functional medicine sees things ahead of time and prevents it from happening. So instead of me waiting for the patient to drop dead in front of my eyes and me resuscitating them, bringing them back to life and being their heroes, we're actually seeing it ahead of time and letting the patient change the path of illness to the path of wellness, and they become their own heroes.